All right, so Commissioner, we are not
Location.
live but in person on location at the
And the
new.
Waterbury office has a new annex. Thank you to our engineering, Joe Spada and John McCarthy and John DePilla and all the folks that made this happen. Shout out to the leadership here in the Waterbury office
Yeah,
who are very welcoming to us. We came down to take a look. So if you're in the area, it's over on Avenue of Industry
it
here
is.
in
It
Waterbury.
is.
It's a beautiful
Staff from Waterbury's here,
yeah.
and some other staff perhaps
Hmm.
as we assess and realign
Yeah.
available resources.
Yeah.
So really good stuff. Really good stuff. Um, we wanted to start out by acknowledging that October is Breast Cancer Awareness Month, which
Yep.
has a very personal connection to yourself.
Unfortunately, it does. But we use this opportunity every month, every year to really talk about the importance of early detection. Because, for me, we were literally just baby steps into our new administration when I got the
Yeah,
diagnosis and
yeah,
had to make the decision to do a double mastectomy. And I had to rely on my newly formed team to keep DCF afloat during that time. And they did a wonderful job. I have my final surgery in a
couple
couple of
weeks.
weeks.
Yeah,
But it's been a long haul, and I really hope that because every year we talk about breast cancer
yep,
awareness and mammography and ultrasound that people should do pretty regularly. There's always someone who reaches out to talk about how that this has impacted
yeah,
themselves or their lives. So please, for all the women in your lives, and it's not just a woman's issue.
correct.
Really make sure that you pay attention to your health as it relates to early detection.
Correct. I mean that you've been the champion for that. Early detection saves lives, and we're actually going to put in the memo.
Hmm.
This goes out to staff. Some links to both a DPH website where information's available to schedule mammograms, but also some national sites. There's some really
Really
good
good.
stuff out there, especially for those who are uninsured
Hmm.
and low income.
Hmm.
So look for that in our memo. We also know that October's Domestic Violence Awareness Month,
It
which
is.
continues to be an absolute epidemic
Hmm.
in our community. That coercive power and control that is exhibited.
And over the pandemic, those numbers just skyrocketed.
Yeah.
When you think about the coercion and control and isolation,
Yep.
and really when folks are not connected to their natural supports, that makes the vulnerability for intimate partner violence that much more real and accessible. So
Yeah.
we want to make sure that it's not just a wear purple; it's a real awareness to the impact of violence exposure to kids and the people who care for them.
You bet. And we're going to put the number into the CT Safe Connect,
Hmm.
which is great because not only can somebody in need of services call, they can also text.
Yeah, yeah.
So that's another layer of intervention
Hmm.
and safety to allow people when they're asking for help. So
For
that's really
sure.
great.
And thinking about, asking for help and what that community interventions are available. I'm really struck this um, time about what we've experienced over the
In
last
Bristol.
few weeks in Bristol. Yeah.
Yeah.
I raised my kids in the Bristol community, and when I heard the just awful tragedy that befell the officers there, my heart stopped for a minute because I can't
Yeah.
imagine what that's like for our law enforcement partners. And I know that, particularly the staff that are in that catchment area that are really close to that particular police
Hmm.
department. But then, across our department, as we partner with our law enforcement folks, and, I know many of our staff members are married to or have law enforcement officers in
Relationship.
their
Yeah.
families, that hits home.
Yeah.
We're first responders as well. This program is
Yep.
available. And just to be able to appreciate the stressors that families are under when you work in community like that. It's just,
Absolutely.
I mean, heartbreaking,
Awful.
absolutely
Yeah.
heartbreaking.
Yeah. My brother-in-law is a lieutenant, and I have a number of friends that are police officers. And as we were saying the other day,
Yeah,
I outreached to some folks, and
me
the
too.
response back was instant. Thank you so much. We appreciate that. It's a very difficult time. So,
Hmm.
when you see a member of law enforcement in the community, pull over,
Yeah,
thank them, say hello.
yeah.
It goes so far, especially now.
Hmm.
And we know that our law enforcement partners are so critical to assist us
Hmm.
in our mission to support and empower families and obviously ensure child safety.
Yeah.
There's been a lot of discussion over the past week about fentanyl and the
Oh my
effects of
gosh. Yeah.
fentanyl, starting with the guidance provided by the department regarding fentanyl use in families. You want to talk a little bit about that? Because this
Yeah.
got a lot of press as well.
Yeah, it really has. And I think, shout out to Chris Robles and our clinical and community support folks, because they really have, understood the necessity of doing additional research to ensure that our staff have what they need to understand the lethality of fentanyl and why this is something that deserves our more laser focused attention. Yeah, substance use is something that we know has comes up in a lot of the cases that we work with. Yeah, with the, like we were just talking about, domestic violence and substance abuse sometimes go hand in hand. This kind of takes it up even further as we think about the Child Advocates report that just recently released, talked about, I think it was 8 children over the last couple of years have died of fentanyl poisoning and ingestion, and we've seen significantly more kids revived by Narcan through the first responders. And so understanding the impact of fentanyl, using our multidisciplinary supports, really helping to make sure that we're making real good assessments of potential dangers for kids. That's what that guidance really speaks to. So if you haven't seen it, make sure you take a look at that memo again, because it really does kind of highlight the additional exposure that fentanyl poisoning is getting these days.
And you mentioned, Chris Robles and and Joshana Gurrier in our clinical and community support division. Now again is a good reminder. Link up with the RRG.
Yeah.
Right.
Yeah.
Consult. Multidisciplinary approach to these cases, and that's what the short-term guidance indicates as we are putting together our longer-term guidance.
Yeah, like Lindsay Miller was talking yesterday in our meeting about kind of reaching out to the clinical leads in each of the offices and really trying to get our arms around the numbers that this is impacting, and it's significant.
Huge.
It really is significant.
I think in one office alone we had 77 cases.
Families, it was significant.
One office.
Higher than what we had anticipated. So stay tuned for more information on that. We're about to partner with DEMIS on some public awareness campaigns. But the impact to kids on because of fentanyl is something that we have to pay attention to.
Absolutely.
Also staying in that division, we recently had the head of HRSA here with Senator Murphy and Blumenthal and Representative Hayes come and talk about that
Access Mental Health.
Mental Health that just got an additional boost from some federal funding. And Access Mental Health is that program that pediatricians can use to get some assistance in terms of how to make clinical recommendations for their patients. So we found, several years ago that pediatricians lacked the clinical knowledge of what resources are available for their families. And so Access Mental Health was kind of birthed out of that. And so now there's enhancements to that program that will allow for consultation for older youth. So that kind of 18 to 22 that we know that are pretty vulnerable. We know that now there's an increase in our 3 Access Mental Health hubs that will allow for more sessions with the consulting clinician as they link to other community-based services. So our community-based service array is growing, and we got some significant shout out and kudos from HRSA for how well the Connecticut system is developed. Shout out to Dr. Stephanie Springer, who kind of helped organize that meeting the other day. But we had a lot of positive feedback for Connecticut.
And I think Danielle Pina.
Yeah.
It was great to see our federal partners want to come to Connecticut to highlight our program. You were there with Senators Murphy and Blumenthal and Representative Johanna Hayes, along with CEO of Wheeler Clinic, Sabrina. So really good stuff. And again, Connecticut being highlighted for our work above and beyond just Child Protective Services. And that's the key. We're the lead children's behavioral health agency for the state. And here's another example of how that work's being uplifted. So
for sure.
As we're wrapping up, I think you have a teaser.
Oh, I do. I do. So I actually just read a notice from a new project management office that we have engaged with to kind of help give our CT kind development a boost. So, please stay tuned for some exciting news about, how we are really going to kick it up related to our IT infrastructure for CT kind and our system there. So stay tuned.
So stay tuned and stay tuned for our next Spotlight on What's Right newsletter, which is going to come out Monday. So a lot of good stuff happening.
Yeah. And one last thing
Last
as we
thing.
sign up, for sure, the last thing is, there's a lot of new people in DCF,
Oh, yeah.
and because people have retired and resigned or moved on or transitioned to other places, so there's new folks coming in. Every day I see a new face, and it's hard in a hybrid environment to get to know people. So this is just my plea that if you have somebody new in your particular area, division, office, facility, just reach out to welcome them, because we know we're one big family.
We sure are. DCF family.
200 strong, and as new folks come on board, we want to make sure that they feel welcome. So we even have Noemi in our, on the 10th floor.
Hello,
with us.
Noemi. Welcome. Your first video.
That's right.
Yeah.
So for all of you to from us, we're signing off, but we can't wait to continue to see just some of those things that we talked about this time kind of come into focus over the next couple of weeks.
Absolutely. All right. Commissioner, take care. Take care, everybody.